Hi, everyone. I wanted to take a few minutes of your time and go over these slides with you so that you have a good idea of what we're talking about as we get ready to look at the different ages of development of children. So, since it's snowing out, I thought this was probably the best way to get started on this conversation, and so that you're really well prepared to talk about child development, understanding that really child development begins prenatally and with the genetics of the parents. So that's where we're coming from. And you may be watching this on St. Patrick's Day, so I wanted to wish you a happy St. Patrick's Day. So meet my leprechaun. So the first slide I want to bring you to is genetics. What is genetics? When we're talking about genetics, we're talking about things like what are the inherited characteristics that we have. And I want you to think for a minute about what you think about when you think about DNA. What does that mean? And what is your DNA? Because DNA is really the chemical processes, right, that tell your body what to do. So things like what color is your hair? How far apart are your eyes set? What color are your eyes? How tall are you? And even your intelligence is influenced by your DNA. And on top of that, we have to remember that genetics, when we talk about genetics, it encompasses your DNA, but also the interaction between genetic processes and the environment that we live in. Your environment highly influences your development. And we've talked a lot about that previously when we talk about childhood trauma and the environment that children grow up in. But along with trauma, we also talk about those positive influences that happen in the home, as well as when we talk about the development of the child prenatally and what the environment is like for that child in the prenatal environment. So it's complicated, this development between this relationship between genetics and environment. So traits emerge from these genetic and environmental factors. So there are dominant and recessive traits. So for example, brown eyes are dominant over light color eyes. So chances are that if your parents have one parent has brown eyes, the other has blue eyes, usually the child will have either hazel eyes or brown eyes. However, sometimes you find, especially if the mother has blue eyes, that the blue eyes do emerge, but it's less common. These certain traits are more dominant. Dark hair is more dominant over lighter hair. Curly hair is more dominant over wavy or straight hair. Co-dominant traits are when we talk about when genes are very closely aligned, the genetic makeup of two people is very closely aligned, and when that happens, certain genetic mutations can occur. So in African American people, people usually are tested because their children may be more susceptible to having sickle cell anemia. That can happen develop prenatally. With Jewish people, with people who are Ashkenazi Jews, we see that Tay-Sachs syndrome can develop. So there are certain co-dominant traits, and they're easily testable now and addressed prenatally. There are certain genetic traits that are associated more with men than with women. So, for example, men tend to have higher incidences of color blindness and hemophilia, especially. We see that mostly in men, though occasionally it happens in women as well. And then there are certain traits that occur when we have polygenic traits. These are with multiple gene actions. So when we look at the height of your parents, we can usually tell what your height is. Your weight will be around what the weight is, what your parents' weight is. Skin color is usually a mix of the two. So we see that children who come from Parents, we have a very tall parent and a shorter parent. We usually get a child whose height is often in between the two. We have children who have a parent who has darker skin and lighter skin, and we get a blending of the two. That sort of is a very nice blending. And then there are certain behavioral trait examples. So we look at intelligence, aggression, shyness. These are all behavioral traits that are linked to the behavioral traits of our parents, including alcoholism. Though alcoholism tends to fall within that disease category, and it has and any kind of addiction disorder. So we wouldn't just identify alcoholism. We'd say any addiction disorder we see. So the likelihood of these things increases if both parents have that genetic trait. So if you have two high IQ parents, you tend to have a high IQ child. If you have two highly aggressive parents, you tend to have a highly aggressive child. And it's the same thing with addiction disorder. But remember, it's a tendency. It's not an absolute. There's always variation in behavior, variation in development. Sometimes this is just variation in the genetic makeup, but it also can be variation in terms of the environmental influences. So what is heritability? Heritability is when we talk about whether or not you're statistically liable to have this particular characteristic. So we talk about probability. So it doesn't mean that it's something is going to be definitely inherited, but it means that your chances are higher. And genes don't always directly map onto a person's behavior, but we know that with heritability, the likelihood tends to be higher. So, and remember, this is where it becomes really important when we think about heritability. We really talk in that case about what is the genetic makeup of the parent, and then what is the likelihood of, because of environmental interactions, the likelihood becomes higher based on or lower based on the environment the child is brought up in. And by environment, we can mean things like the chemical environment, like high pollution and exposure to certain drugs, or exposure to certain experiences. And those experiences can be positive or negative. Just like if the nutrition is very positive, that exposure works very well. The interaction works very well with the genetic makeup of the individual, just like if the nutrition is very poor. We'll talk about that a little bit in the next slides. So what influences a developing baby? Teratogens are agents that directly influence the developing baby. So when we talk about things like drug, disease, environment, these all can be very, very harmful to the developing embryo or fetus. And it really can impact, especially in the early stages of the prenatal development, when we're talking about body part or organ system development. So that when you see a child who is born without part of their arm, or that might have problems with their heart, that can be because of an interaction between the genetic makeup of the parents and the environment around them. It doesn't always happen, but sometimes it does. The amount of exposure and the particular timing of it in the fetal development is what really determines the amount of harm. So if a mother has one glass of wine before she realizes that she's pregnant, probably there's not going to be any problem with the fetus because of that alcohol. But if she is an alcoholic and drinks throughout her pregnancy, then the likelihood of the child developing, of having fetal alcohol syndrome is obviously very high. So things like that kind of exposure to environmental or issues can lead to things like miscarriages, birth defects, and other problems, including emotional or behavioral issues. The other now, so some of that are lifestyle choices, and some of those are disease related, but there are also infections and diseases that a mother can be exposed to. So when we talk about mothers being exposed to something like measles, or women who are pregnant, so I shouldn't say women who are pregnant being exposed to something like even the flu, or being exposed to highly infectious um, kind of like infections and that kind of thing. But especially something like the measles can cause birth defects and miscarriages. Drugs and chemicals react also with the genes. When we talk about things like even taking aspirins, which cause an increase in bleeding, caffeine, more than a cup of coffee a day is usually what's recommended, can interfere with the child's development, and of course, any other prescription and non prescription drugs. And when women are pregnant, they will usually talk with their physician about the kind of medications that they are taking. Maybe they're taking medications for bipolar disorder or asthma or diabetes, and these all have to be documented and reviewed with the physician to make sure they are not that how they can be taken safely and not cause harm to the child. And there's been a tremendous amount of research about this, a tremendous amount of progress with this. Obviously, non-prescription drugs get more and more, make things more complicated. So even some types of vitamins have to be discussed with the, and should be discussed with a physician when a mother is pregnant. But then any kind of narcotic, even drugs that, when we talk about things like alcohol is a drug, marijuana is a drug. So the mother needs to think about all of those when she's pregnant. It will affect the fetus. There are also environmental hazards, or hazards that are silent threats, we call them, right? So these are things that are in our atmosphere that we have exposure to and can impact the fetus. For a mother who lives in an area with high levels of pollution or high levels of chemicals in the air or the water, this can impact her developing child. So pesticides, lead exposure in the home, mercury, which can be found in fish, radiation for a woman who may work in a hospital or in an industrial setting where there's a high number of radiation. Pregnant woman may not even be aware of all of those and needs to review these as she's going through a pregnancy. And then there is the influence of the father, especially in terms of things like secondhand smoke, if the father smokes, or any kind of DNA mutation. There's also some research that's been found that with older fathers who are in their 50s or 60s, we see a higher incidence of children with autism spectrum disorder. There isn't an exact link there, but there is some research to support that. Okay. There are, however, protective factors. And so it's not all bad news, right? So we know that there are all these things that can influence our unborn children, but we also know that there are lots of things that we can do that mothers can do to prepare and to take care of their unborn child. And I'm going to stop the recording now because I only can do this for 15 minutes. And I'm going to pause, and then we'll come back and talk about the good news.